Natalie is a very hardworking, beautiful, strong young lady.
Someone who is driven, an athlete, runner, bicyclist, swimmer.
She's just a really strong, self-confident woman.
Absolutely someone who loves people, loves children. She works with kids at Swim RVA. She's dedicated her life to helping people.
I just was really attracted to that fire that she brings to everything that she does. It was cool for a middle of the summer morning. She was getting ready to go for her bike ride. As I was getting ready, preparing my bike to go for my bike ride, so I left to head out to my event outside of Charlottesville. That's when we parted ways that morning.
Being a cyclist, I think worst case scenario right off the bat.
We got to the scene where we saw the first victim. I saw a young man doing CPR.
I found her lying in a ditch. She was awake. She was talking. I asked her name. She was able to tell me her name. More importantly, I asked her if she remembered anything, and she said she didn't remember anything. She had quite a bit of road rash. Was the first thing that I recognized. Pale.
Just making sure her respiration's okay. Making sure, him as the ALS provider, make sure he has everything he needs to do his job.
I believe her blood pressure was in the 80s, 70s or 80s, which in a trauma patient, we want it higher than that. That indicated to me that she potentially had some significant internal hemorrhage. My job was, to get fluids in her. I do recall that I had a hard time getting an IV. After I knew she was relatively stable and I had that IV in place, I could get fluids in her and start trying to increase her blood pressure that way. Got on the phone with the comm center at VCU and tried to give them as much time as I could to let them know that I had a critical trauma patient coming.
Everybody pre-assembles when we know that a big trauma like this is coming in, and we put our heads together, come up with a game plan before the patient even comes. So we knew that she was hypotensive in the field, so we know there's a potential for life-threatening injuries right off the bat.
The primary concern for her was that she was bleeding and she was having hemorrhagic shock because her blood pressure was low and some of the other things that we were looking at. So then my next job is to determine where is that coming from, so how do we need to treat that and stop it. And the faster that we do that, the better her outcome is going to be. So it's fairly high pressure. We need to work through those steps very quickly. We need to function really efficiently as a team.
She was definitely critically wounded. She was covered in road rash. She was pale.
So she was in a lot of pain when she came in. We do an exam with ultrasound called a FAST exam, and the goal of that is to do a 30-second ultrasound and look at all of the sites in the body that we worry about bleeding. So we were able to, within minutes of her arrival, establish that she was bleeding into her abdomen, and that helped guide our next decision, which was to head to the operating room. So we did an exploratory laparotomy, which is looking inside of the abdomen and finding where she was bleeding from, and then repairing the areas that were bleeding. I'm glad that we were able to get her to the operating room so quickly and get her asleep under general anesthesia because she had a lot of very painful injuries, and that's really stuck with me about her is what she was going through.
When they called me, they said that she's in surgery right now.
And I was worried that we were going to get the bad news that Natalie was dead.
She had multiple broken bones, broken ribs, bruising to her lungs.
It's a stressful time because she had so many different injuries, and especially since she had had some intra-abdominal injuries, along with lots of broken ribs. I think she shattered her pelvis pretty badly.
She was in rough shape. It was a frightening experience. I was afraid we were going to lose her.
It's that kind of tentative time when you're not quite sure which direction a patient's going to go.
We had to find Brian because Brian was out in a race, and I was the one who tracked him down and had to give him the news.
Whew, it was awful, and I remember kind of crying out a little bit. It was kind of hard to process all the emotions going through your mind at once.
I just remember saying to him, she is so tough. I mean, she's just a fighter. And I said, don't allow yourself to go there.
I knew that she was in for the fight of her life, and that nothing was guaranteed.
I have to balance. Sometimes I think my job, I want to make sure that people have information and know what's going on. So kind of educating about what injuries we were dealing with, but not overwhelming them, because I could see that they were still in such a state of emotional shock, still processing everything.
They were all just so caring and gentle and I don't know, nice about it, and
very compassionate.
That's the best word. Yeah, you could tell that they all really wanted everything to be okay, and they were doing everything they could in their power to make that happen.
The surgeon obviously was in the OR with her, so they will dictate a lot of the care. What are the blood pressure goals? What do they want to do with the ventilator?
When she first came up from the OR after the liver lac repair, her blood pressure was pretty high, actually, and her heart rate was high. She was sweating, and she had tears coming out of her eyes. My first priority was getting her comfortable, starting her on continuous pain medication, and letting her know that she was in the hospital in the ICU, that she had a breathing tube to help support her lungs while we tried to figure out everything that was affected by the accident. I remember letting her know that her parents and her partner were on the way, that she was safe, and just holding her hand. And we could tell that once the pain medication started, her forehead sweat receded and her heart rate and blood pressure came down to normal levels.
I'll never forget the first response that I got from her was I was holding her hand and she was able to squeeze my hand. So from the first hand squeeze, I kind of said, she's there.
Yeah, I remember her parents, I told them, when she gets extubated, that's going to be a big deal because she's going to have to know her injuries. Right now, she may not really be listening to everything we're saying, and also what happened to her friend. It's a lot to tell someone in one day.
She had really supportive, wonderful family, so they had a lot of questions discussing how they could help support her. After you've been through a traumatic injury, you have a lot of different things that are going on in your brain, and then obviously if I'm working with a patient who's also suffered a loss, you're also processing that grief and loss on top of all of the other things that come around with hospital stay, so it can be a lot at once.
The morning of extubation, you have to lighten up someone's pain medication and sedation. So in doing with that with someone with her injuries, you have to be pretty worried that she'll wake up anxious, very scared.
It was a huge relief to see that happen, but at the same time I knew that that was going to be the beginning of some difficult conversations.
After that, it was more just about pain control and getting her ready for the next steps.
One thing I really appreciated with Natalie is that vulnerability on those difficult days, whether it was with myself or her family, to be able to take that opportunity to really process and digest what she was going through and to reach out for the support and help that she needed.
We knew that her first question was going to be about Jonah, and we told her, and she just said, oh, I'm going to have to live for Jonah.
I actually transferred Natalie from here, from the ICU, to our unit. And she was having a lot of trouble with pain because her leg was in traction. It was in 16-pound traction.
It is a pin through their bone. It's not comfortable. The idea of it is to kind of hold everything out to length to give them some pain relief, to keep a little bit of pressure off of that acetabulum or the hip socket, so that we can better fix it.
Aside from the pain, there was also a lot of anxiety about coming to a new unit, not knowing what to expect. I want the best for you. There was no doubt in my mind that I wasn't going to do whatever I could for Natalie.
One of my first encounters with Natalie, I'll never forget. I walked in, met her, knew what had happened to her, expecting someone to be angry and upset, but she said, I just turned 30 years old, 30 was supposed to be my year, and then I got hit by a car. And that was when I was like, this girl and I are gonna get along, I'm gonna help her through this.
Natalie developed an infection that caused her heart rate to go up into the 170s. Her temperature was 103, and she was having a really hard time. And I ran into her room when the alarm started going off, and we quickly called a rapid response to try to figure out what was going on.
It was a frightening experience. Usually when you see a bunch of nurses, doctors working around someone, it's frightening, it's serious.
There were so many people in there. There were multiple doctors, multiple nurses. We had to ask her father to step out into the hallway, which he was glad to do, but made her even more scared.
Fortunately, they got things under control. They administered antibiotics, I think, and other medicine to stabilize her.
At one point during the rapid response, she grabs my hand and she looks at me and she says, Olivia, am I going to be okay? And I could see how terrified she was when I looked into her eyes, and so I told her, I said, you're going to be just fine. There's just a lot going on with your body right now, and we just need to help it calm down. And then as long as we could explain it to her, she was game. She would just keep going through whatever she needed to go through to get through it. And that only speaks to how courageous she is and has been through this whole thing.
It's almost like her socket was split in half and separated out, and her other side of the pelvis was split in half on the front. I talked to her. She appeared very calm, actually. I was surprised how calm she was in spite of all the injuries she had, but you can tell the anxiety and the questions when you talk to her. So when I explained to her that, hey, you know, you have a massive injury, it is not about fixing it, but it is about getting it right, and getting it right to the point that you return to your pre-injury level. It's a young girl who is very athletic and has a long way to go, a long life, and her life depends on how accurately you reduce this fracture. So when we got the back lined up, it seemed like the front came kind of a little bit closer. So then we used this screw through the side of the smaller incision, and this is a tricky screw because there's nerves and vessel higher up, and you can penetrate the joint at the bottom. So your margin of error is about 2 millimeters.
The first time we saw her, she was non-weight bearing on 3 of her extremities.
All 3, yeah.
And also in an incredible amount of pain.
Talking to her initially about her goals, and then talking about how we can reach those goals, and while giving her breaks and making sure that she's not in excruciating pain when we're moving around, but kind of saying, all right, we got to push just a little bit. We're going to take it step by step. She was so motivated, which again came from her being an athlete. She wanted to get back to riding her bike, and while in that acute setting it seemed so far off, but I think that was kind of what helped continue to drive her.
This is what I work with physical therapy a lot as well, is to say, okay, but can we let her stand pivot on one leg to get into a chair? So we look at her imaging again and give her a little bit more freedom.
We talk about it. I say, well, 100% you'll walk. The question is, can you go back to biking or not? It all depends on how you heal.
Actually being able to overcome the pain and go from basically laying flat on her back to sitting edge of bed.
Looking out the window.
Yes.
That was a big milestone that day.
The determination and the look on her face when she got into the chair, and she didn't have any family there, but she looked at me and she said, Haley, will you do me a favor? Will you take a picture and send it to my mom? And to this day, I have that picture of Natalie.
The main challenges when she first came to us were all her orthopedic injuries. She had a lot of restrictions. She wasn't able to lift her right arm above shoulder height. She wasn't able to bear any weight on her left leg, and she was approved to bear weight on her right leg and her right arm only for transfers. So her only option was to learn to use a wheelchair.
She realized that she was able to gain a little mobility in the wheelchair, and at that point she became a little terror on the wing where she was staying because she wanted to wheel around everywhere.
We were able to move into teaching her adaptive strategies, using adaptive equipment to get her clothes on, how to transfer while following her weight-bearing restrictions, and just get her back to some normalcy. Once we showed her something, she had it down. I could tell that she was very motivated to not only get home, which was the immediate goal, but to really make a full recovery and get back to the things that I know she loves doing. After a few weeks, we were able to work on range of motion on her shoulder, regaining that. And towards the end, she was able to gain weight bearing on one leg, and the other one was partial weight bearing.
Patients, they are very uncertain. They haven't put weight for so long. And again for a surgeon, although looking at the x-ray and the reduction was good, you have seen the x-rays and everything's healing, I would expect her to do well. But at the same time, you want to see what they do. It's almost like your baby in the first time walking. You're going to see it. This is satisfaction for surgeon and patient equally.
She really appreciated how Dr. Satpathy would kind of challenge her in some ways that she might not have felt comfortable challenging herself. He would ask her a question like, have you tried walking? And she would say, oh no, I was supposed to be using the cane. And he says, well, let me see you do it, right? And so it was that kind of green light that she would get, and then suddenly she was like, it just happened.
When she first came in, a lot of what our focus was revolved around weight bearing and walking, because especially with pelvic fractures, she had a lot of orthopedic precautions as her bones were healing. So we initially had her in our harness system. It's a passive harness, so it didn't take any weight off of her necessarily, but it allowed her to do some exercises in a safe way where we could kind of see how ready her limbs were for her to be able to do some walking and some step and stair training without needing the crutches or the cane. Dealing with the limitations of her body, was probably more of a challenge for her. And I think being there as a coach to say, you know, this is normal for where you are in your recovery. We expect for you to still have some difficulties with X, Y, and Z, and this is how we're going to address those. She took all of our recommendations and like went to the gym and did those things. And it was like, I mean, she's really just kind of like the perfect patient. So she was like, what can I do? When can I do it? How much can I do? So it was really just kind of about making sure that we were finding a good balance of like her mental readiness versus her physical readiness. Natalie is the kind of patient that reminds us why we do what we do. I think she's one of the most resilient patients I've ever worked with because she's just so motivated and driven.
It's very fulfilling knowing that you even had, you know, a small impact in helping someone get their life back. And who knows how many people she's going to impact.
Absolutely.
It's really neat to be a part of something bigger than yourself, right? So just being a part of this team and everything that we see day to day is unimaginable. It's really a gift, what we can kind of offer them, and they're a gift to us too.
That's what you live on, right? This is what the satisfying part, being a orthopedic surgeon, trauma surgeon, or joint surgeon. You got a person who gets back to pre-injury, almost pre-injury level, or even better than that sometimes, with the care they get. So absolutely fantastic teamwork here.
Meeting someone who's having the worst day of their life many times, and then being able to help them cope with that and fix injuries, that's, you know, incredibly fulfilling.
I love that about trauma, is that it requires so many different people, and it requires them to work together and coordinate. Everyone's always focused on the patient. So at the end of the day, that's all that matters.
It's an organization that is just dedicated to helping people, and that's the amazing thing. They're unsung heroes. They're I have gratitude to the people that prepared her meals and took the trash out.
She has not only survived, but she's thriving, and she's, as Kirby said, she's beating everyone's expectations. I truly believe that her physical fitness, her mental fitness is one of the things that got her where she is today. It's inspirational.
I think she's finding almost a newfound strength in herself. She's learning something about her own body's ability to recover that is shocking and surprising even to her. Definitely cycling will always be a part of our lives, but at the same time, maybe it's a good opportunity to kind of pull back a little bit and see what other adventures we can find in the city.